Okay, Faith.
I can't record.
The recording has started. Faith, you can
Okay.
start the presentation.
That's true. Okay.
Good morning, everyone. My name is Goodluck Faith Chidima, and I'll be presenting how to utilize Agile in healthcare system. So here we have our outline, which is what is Agile, how does this work? Sorry, can you guys hear me?
Yes, we can hear you clearly.
Can you put the
we can.
slide view so it can be more visible?
Sorry?
Can you put the presentation on slide view so it can be more visible? I think it's at the bottom. It's at the bottom. It's the right. Yeah, yeah.
Is it better now?
Yes.
Yeah, it is.
So utilizing Agile in healthcare system, we have our outline here. What is Agile? What is Agile methodology? What are the 6 steps in Agile methodology? The 3 key elements of Agile methodology. What is health? What is healthcare system? The 3 primary groups: Agile healthcare, benefits of Agile project management in healthcare, and conclusion. So sorry about that. What is Agile basically? Agile is a time-bound iterative approach to software delivery that builds software incrementally from the start of the project instead of trying to deliver it at once. So apparently for Agile, it makes use of some approaches, which is known as iterative approach. Like there's actually time frame. With this time frame, it helps your project to look more improved instead of just making it look bulky. So you tend to like break it down into little bits known as user story. That's the functionality. And we use the iterative approach in this case, whereby we can say, okay, 2 weeks interval or maximum, that's 4 weeks interval. And here's a diagram showing basically giving us a mental picture of what it is like. So I'll be moving on to how does this work. So you make a list. So making a list basically has to do with what features your client wants. Your client can tell you that, okay, in this project, I need this, I need that. So you try to make a list to at least give you an idea of how to execute it instead of just rushing, like making a rushed work. Then you size things up basically. Sizing things up has to do with which project is actually less bulky, which project will require lesser time. So imagine a client that wants the project to be done next week interval, and there's another client that wants a project to be submitted, let's say in next month or next 2 months. Obviously, you have to deliver and work with the clients that actually wants the project to be delivered next week. Then it still boils down to like setting priorities. Setting priorities basically has to do with when in a project we have user stories, and it's just like I want to create and I want to, as an NYC portal, I want to obviously have I want to first of all register my data before having access to my login. So you tend to like prioritize the one that is actually more important than the one that is actually less important. Then we start by executing these plans. You update the plan as well. You let your clients know what is going on with this project, and you actually inform your team members, carry your team members along with the project. And how does this help? Unleash innovation and creativity. As a project manager or as an agilist, you should be open to whatsoever changes your client brings. Your clients can tell you that, okay, I want this to be added to my project, or I want this to be removed out of my project. You can say, okay, based on the previous plan or agreement we had, I am not actually being open to changes. No, you don't do that when it comes to Agile. So the second is enable clear priorities so that teams know what to build. So it gives like insights and giving like priorities, letting the team know which one will actually come first before the least important ones. Then we have enable teams to continuously improve their work. With Agile, your work will be improved instead of just working and at the end of the day, you won't see any job done. Then build visibility of work, focus teams on delivering value to customer. With Agile, the values of the customer is actually going to be delivered effectively. And we have the Agile Manifesto. It's a document that sets out the key values and principles behind Agile philosophy and serves to help development teams work more effectively and sustainably. So this is officially known as the Manifesto of Agile Software Development, and which is the 4 values and 12 principles. For the 4 Agile values, everything here is very, very actually important, but one has to come, or more has more priorities over the other one, which is individual interactions and over processes and tools. When we talk about individual interactions, not just in the tech about, even in healthcare facilities as well, you have to have a good interpersonal relationship with your clients, with your team members, and so that the work will actually be more effective, not just making use of the processes and the tools involved in it. So we have working software over comprehensive documentation, ensuring that every software must have its own work and function being done properly instead of just going straight to document. Then we have customer collaboration over contract negotiation. In this case, most organizations, they're just quick to like accept the contract and make agreements based on the money involved. But with that time, you can tend to like have a good collaboration with your customer, with your client, knowing what your customer wants, establishing a good relationship with your client to actually understand your client well, so that later on you won't be having issues with communication and cooperation with them, basically. So the last is responding to change over plan. Which I stated earlier when I was talking about innovation. In this case, you should be open to changes, not just following the plan. Your client obviously definitely will want you to add some things or remove some things. So you should be open to it, not just sticking your mind to the initial plan being brought. So we have the 12 principles, but I'll just brush through this because of the time. So the first is our highest priority is to satisfy the customer through early and continuous delivery. The second is welcome changing requirements, even late in development. Then we have deliver working software frequently from a couple of weeks to a couple of months. Business people and developers must work together daily throughout the project. Then we have the fifth, which is build projects around motivated individuals, and which is very, very important. In every organization, motivation is actually the key, whereby you reinforce positive reinforcement, either words of encouragement or you, it can be material things like, let's say, money. And yeah, we actually motivates the person instead of just giving negative words after so much work being done. Yeah, so that is it. So the sixth is the most efficient and effective method of conveying information to and within a development. Is actually very important, having a face conversation, because some people tend to like misinterpret words when it comes to chatting or chatting basically. So it's very important if you're having issues or you don't understand some things, you want to have better clarity. It's important you actually go like face to face, have a conversation with this individual in your team or the client itself to have clarity of what they actually want or what they're talking about. So the seventh is working software is a primary measure of progress. 8 is agile processes promote sustainable development. The sponsors, developers, and users should be able to maintain a constant pace indefinitely. Then 9th is continuous attention to technical excellence and good design enhances agility. And 10th is simplicity. The art of maximizing the amount of work not done is essential. And 11th, the best architectures, requirements, and designs emerge from self-organizing teams. And we have the last, which is at regular intervals, the team reflects on how to become more effective. And adjust its behavior accordingly. So moving to what agile methodology is. Agile methodology is a way to manage a project by breaking it up with several phases. And we have some steps here. We start with plan, design, develop, test, release, and then we have the feedback. Then we have 6 steps in agile methodology. But we're going to start with project planning. In every project, there's always a plan whereby sitting down with your client will tell you, okay, I want these features, I want this project to be like this, and probably giving you a time frame in which this project will be delivered. And product roadmap creation basically has to do with direction of how the project is going and where the project is going. Then we have release plans. Sprint planning basically has to do with the time frame in which this project will be executed. Is it in 2 weeks interval? Is it in 4 weeks interval? Then we have daily stand-up. Daily stand-ups are actually what we practice here in Beacon, whereby we have the morning and the evening stand-up. The morning stand-up basically has to do with what our plans for that day and how we're going to execute it. And the evening stand-up is basically telling us the activities we have done for that day and if we face any challenges. Then we have the sprint review and the sprint retrospective. The sprint review basically has to do with reviewing the things like the project being done within a particular time frame and knowing if we have actually achieved something. Then this is actually carried out within the team members. And we have the retrospective basically has to do with what we have achieved, what went wrong, what we as a team members would have done better basically. And we have 3 elements of agile methodology, which are the collaboration, constant focus on business value, appropriate level of quality. So I'll be moving on to what is health. So health, according to the World Health Organization, is a state of complete physical, mental, social, and well-being, and not just a mere absence of disease and infirmity. Then we have what is the healthcare system. A healthcare system, also sometimes referred to as a healthcare system, is the organization of people, institutions, and resources that deliver healthcare service to meet the health needs of the targeted population. So here are the people that makes up this healthcare system, but the major important person in the healthcare system is the patient. Without the patient, really, healthcare professionals will not be in place or won't exist, basically. So we have nurses, doctors, radiographers, medical lab scientists, physiotherapists, etc. rather. And nurses are the ones who form the backbone of the healthcare system, basically, both in public sector or in the private sector. So we have the 3 primary groups, which are patients, administrators, practitioners. Sorry, how many minutes do I have so I can just rush through? So we have the agile healthcare. Agile healthcare emphasizes patient satisfaction and rapidly deploying functional applications. To better understand agile application for industry, healthcare professionals should start with the history, principles, and benefits of this approach. And agile enables healthcare teams to innovate by empowering teams to quickly assess and address problems in care delivery, medical supply acquisition, personal scheduling, and numerous other healthcare related tasks. So agile in the operating room, basically. In the operating room, basically, it has to do with where surgery is being performed. We have the 3 parts, which is in perioperative, which is pre-op, intraoperative, and post-operative, basically. And we have individuals that forms this team, which is, we have the sterile OR routine and the unsterile OR routine. For the sterile OR routine, we have the operating surgeon, the assistant surgeon, and the scrub person, which is the nurse. Yes, can be the nurse basically. And we have the anesthesiologist or nurse anesthetic. We have the circulator, and we have the members that actually makes up this operating system. So I'll be moving on. This is the diagram basically. So for Agile to be implemented in these settings, the scrub nurse, which is wearing the surgical scrub, needs to like bring out the instrument that actually suits this surgery they're actually performing. So to make the work actually easier and to save time, instead of just trying to pick up, instead of just having so much instruments on her table and getting confused, because the instruments are actually being merged, getting confused on the particular instrument she's meant to pick. So it tends to like save time. So before the surgery is being performed, the scrub nurse needs to like pick up the surgical instrument, the sterile surgical instrument that will be used for the surgery beforehand. Then we have the circulatory nurse. She ensures that every thing or activities done in the surgery, even before the surgery, is being done properly, and make sure that the patient gets maximum satisfaction from the procedure that is going to be carried out. And the circulatory nurse as well ensures that everywhere is being sterile, the supplies are actually being in place. And we have the assistant surgeon that helps or carry out the instruction being given by the chief surgeon, basically. And here is our patient. So benefits of Agile project management in healthcare tends to like increase productivity and efficiency, better self-organization, access to extensive backlog, improve communication, enhance patient care, then give better access to critical information, innovation, thereby open to like new ideas. Then in conclusion, by looking at all the benefits that come with Agile project management, it's very important. Sorry. Okay, it's clear that an Agile solution can be a critical component in any healthcare institution. Agile project management improves day-to-day operation, ensures better doctor-patient relationship, a more organized medical staff, and ultimately creates an efficient and productive workspace. Please, do I still have more time? Hello, is that
Yes, you do. The second presenter is not on the call, so.
Sorry? How many minutes do I still have?
You have, let's say, 10 minutes more, because the second presenter is not available, so.
I'll be talking about how does this work, because I generally explained how it works for the tech, as a project manager, how it works. So I'm going to talk about how we're going to implement this Agile in healthcare system, basically. So I'll be using the 4 Agile values and the 6 steps in Agile methodology in the healthcare system, basically. So for the 4 Agile values, we have individual interaction over processes and tools. So in the healthcare facilities, we don't just make use of our instruments or just the tools. We need to interact with different professionals in the healthcare system so that the patients will get the satisfaction they actually need. Then we have working software over comprehensive documentation. So in the healthcare system, we ensure that every instrument, every machine is being in place and is being used effectively for this patient, just like carry out vital signs and catheterization and the rest, not just going in and documenting what is actually being done. So we have customer collaboration over contract negotiation. When a patient comes in, we tend to like establish nursing, patient-nurse relationship basically, and not just getting the money. We ensure that the patient gets value for their money, basically, and we make sure that the patient is actually being, the procedures are actually being done, starting from the time the patient gets in, starting from the assessments, getting the history, taking the vital sign, and giving the patient bed rest, basically. So we are responding to change over following a plan. Imagine a patient that wants to carry out a surgery, and the initial plan was to amputate the left part of the arm, and probably the patient agreed initially. And let's say with time, maybe the patient needs to think and all, the patient might come back and say, okay, I don't want this procedure to be done again. As a doctor or as a nurse, you won't obviously want to, you try to convince your patient to let them know the benefits of this procedure, like to reduce infection so that it won't transmit to other parts of the body. So what you need as a healthcare personnel, the only thing that can happen is for you to give your patient adequate knowledge about this procedure, and it's left for the patient to agree or not to get. So the patient can say, okay, I'm not doing this procedure. You can't actually impose it on the patient. So that is it about responding to change over following a particular plan. So I'll be moving on to what are the 6 steps. So I'll be implementing this in healthcare system, basically. So with project when you start a project, what are the plans you need to carry out for this patient? We know that when you come to the world, we have like different settings, the infectious patients, the one that has less infectious, the patient that are actually less infectious, basically. You tend to like separate them, like isolate these people, and you take their details. Obviously, you know their details. This is patient A, this is patient B. Basically, you like make planning. Okay, which patient needs wound dressing, which patient needs this medication, basically. So with you planning before, that's why we have handing over. Basically, you tend to like discuss about these things like within your team. Like let's say people that did night shift, basically you tend to like discuss it, and they'll hand over to you. So that is part of planning, and they'll let you know what this patient went through within their period of shift, so that you can have adequate knowledge and keep executing the plan. So we have the product roadmap creation. That is the direction. How would this plan be executed, basically? Then we have releasing the plan, then sprint planning. Sprint planning basically has to do with the time frame you're going to stay in a particular procedure, just like vital signs. For vital signs, we make use of at least 2 minutes. We use 30 minutes to check the pulse, 30 minutes to check the respiratory rate, and the rest to check the temperature. So we always have like time frame in everything we need to do. We should obviously have a time frame so that it can actually help us to execute the plan. Then we have the daily stand-up. For the daily stand-up, basically, I stated that it has to do with the handing over. In every organization, we have like a session whereby we discuss these activities being carried out. The sprint review and the sprint retrospective basically has to do with, for the sprint review, we talk about these procedures being carried. Let's say a patient that comes out from the surgical ward, basically, these procedures are actually being done on the patient. Like, how is it like as the patient improve? Does this patient need tonsuring? Basically, you review things about this patient. Then the retrospective has to do with why is this surgery done not improving, or what do you think would have done better for this patient to become more conscious? So that is it for this procedure, basically. And thank you all for listening. And yeah. So this is the patient, the nurse with our patients, and this is the healthcare facilities. Thank you all. I'm done with it.
Thank you, Faith, for your presentation. If you have any question for Faith, you can go ahead and ask. And if there are no questions, Faith, you can ask questions.
I have a question. Hello, can you hear me?
Yeah.
All right, Faith, thank you for this wonderful presentation. Actually, it's a very wonderful one. So, and I love your slide. I mean, the pictures, they are actually, you explain what you're actually talking about. So my question is, talking about the agile methodology in healthcare system, when it's come to the healthcare, like an hospital facility, we have nurses, we have doctors, we have physiotherapists. Should we assume that maybe they should include the knowledge of agile methodology for all the people in the hospital? Let me say, assume that we want the nurses to understand what agile methodology is all about. Or do they might have been practicing something like that, but don't actually know that is what they are practicing. Or you want to have a conference where the doctors will be taught what agile methodology is all about and the other healthcare personnel. Or do you already have something like an let me see, an agile project manager in an healthcare facility? So that is my first question. Then my second question is that agile methodology is like is like a mindset. You understand, a way of doing something incrementally, whereby we have its narrative approach. We develop, we review, we do another one, review, something like that. So, but no, we have several ways of achieving that. So, what is the best approach in terms of agile methodology? What is the best method for healthcare system? Is it Scrum or Kanban? Those are my two questions. Thank you.
Okay, I think I'll start with the second one. I think in the healthcare system, basically, and I think it's something that is actually being implemented, because from my explanation, these are most of the things we do on the world, right? So, and I think we use Scrum basically, because Scrum is a process framework when it comes to agile methodology, agile itself rather. So in the healthcare system, I think we make use of Scrum most, looking at from the sprint review, the handing over and all. I think the Scrum is actually being implemented more in the healthcare system. Then the first one, when it comes to some healthcare system, we have some project managers in place, which we might not really have idea basically, because you have to make use of, okay, this person is a doctor, this person is a nurse, this person is a radiographer. We don't really go into detail knowing that, oh, if this person is a project manager or so. So yes, there are some project managers that are in the healthcare facilities industry.
Wow, I love to hear that. Thank you so much. Thank you.
Welcome.
Hello, Faith.
I have a question.
Oh, okay.
Sorry, talking.
Okay, it's a lot. So I don't understand. You were comparing the activities in healthcare system with the events that we have in Scrum, but it's like I did not get that part of Scrum planning, or probably did not talk about it. What activities can you compare with Scrum, with the sprint planning rather?
What did you say? Can you come again?
What activity in the healthcare system can you compare? Like what are the things that you guys do that it looks like sprint planning?
What are the things we do in the healthcare system that looks like sprint planning? Like I just said, I gave you an instance about using vital signs, right? I said for vital signs, we ensure that the procedure is being done for 2 minutes, because sprint planning basically has to do with the time frame a project is going to be executed, right? Using iterative approach. So we either say, okay, 2 weeks interval, at most 4 weeks interval. But in healthcare system, it's just like carrying out vital signs. I made mention of the pulse, checking the pulse for like 30 minutes and checking the respiratory rate for like 30 minutes. So you know that, okay, the remaining minutes is for checking the temperature, right? So that you know that, okay, once you are done with this particular time, you move to the next task or the next procedure, so that you won't waste so much time in this particular patient. So that is it.
All right. Do you think you can appoint story points to you guys' capacity, like capacity in the healthcare system?
You can actually use user story basically.
Okay.
Sorry, can I add to that?
Okay, thank you.
Okay, so because I understand what healthcare system is all about, and I'm in track of project management. So in the hospital, what we basically do is that let's assume a patient come to the hospital and after doing some definitive diagnosis test, we realize that the patient is having let me just say typhoid. You understand? So we are going to have a line of treatments. That is where the sprint planning come on. So we mean our line of treatment. So we plan to place the patient on let me say Tabzin as an antibiotics. The patient will use that one for like 2 weeks, you understand? Then want to place the patient in it's maybe an amoxicillin or some other things like that, in terms of drug. Then part of our plan is that, okay, as we are doing this thing, after 2 weeks, you understand, want to run that test again, or we require the patient to do some imaging test. You understand? So those are the planning, and it also have a time interval that the patient has to use that has to be on that drug. You understand? And after the patient finishes the drug, we are definitely going to run the test again. So most likely we are doing our sprint review or retrospective. Do you understand now?
Yeah, yeah. Thank you.
Is how it is.
So my question
Hello?
is, hello, can you hear me?
Yes, we can hear you. Go ahead.
So my question is the agile methodology in healthcare, is it a kind of analogy or a kind of principle or ideology that we can extend to other professions? Or is a kind of is it like a standalone ideology for this? Because I'm a bit confused.
Okay, so
Can I answer that? Okay.
okay, you can go now.
Okay. So we say agile is a mindset. Then, and there was time I was talking about agile being a applying agile to our daily activities actually. And if you look at it, the fact that Faith can actually explain agile for us using what they do in healthcare system, I think is something we can use for every it's a principle we can use for anything, any kind of let me say job or work or activities or task that we do. You just need to understand the events and then look at the activities that are involved in those job activities, tasks that you want to do, and then align them together with it. So agile itself is a universal principle, let me put it that way. And we generally use it when we talk about projects. And actually, if you look at the meaning of projects, a lot of the things that we do that we don't call projects are actually projects. So if you can use it in healthcare system, I believe we can use it in a lot of things that we do.
All right, thank you very much. That answered my question. Thank you.
Hi, Faith. Thank you so much for the presentation, honestly, because I think prior to now, the whole idea of Agile is always within this old tech space. So, but apparently it means that it's something that is very extensive and you can basically apply it anywhere. And my first question has actually been answered. The last person asked that particular question. I mean, that, okay, it's a standalone principle that you can just apply anywhere. So what I just want to know, which is my other question, is that, for instance, we do something like daily stand-up, which is the principle, right? Like a morning stand-up and evening stand-up. And you can basically have all the teams there, like let's say the developer, the product manager, the marketer, wherever. In an healthcare environment that you have very extensive teams and probably they don't even meet. For instance, you have the pharmacist somewhere, and then you have the medical scientist somewhere, and then you have the nurses or probably the consultants. How does it work there? Like, what represents something like a daily stand-up? I know you mentioned something like handing over, but that is just strictly within the nurses. So how does something like daily stand-up work within the entire team that work on the patients? I just want to know that.
Okay, are you talking about the health facility or when it comes to tech about like which or both?
No, like I'm talking about it like in the healthcare facility. What we represent a daily stand-up, for instance, which is a principle of Agile, if I'm correct.
So basically, in the healthcare facilities, with the healthcare practitioners here, because I'm a nurse, so I'm part of the healthcare system. We obviously have to like have a meetup basically, and giving information about it's just like the nurse or a doctor coming in. Rather, obviously the doctor is going to meet the nurse in charge of the hospital or the ward, and the doctor is going to ask for the case note of this patient, right? And in that process, the nurse can actually communicate the issues happening to this patient or how this patient is reacting to a particular drug. So in that form, she's actually passing information. That's like having their own personal stand-up. Stand-up can actually be within two people, not just more than two individuals. Same thing with the radiographers or people that handle the diagnostic center, right? Technology has actually made it like easy for us to make use of our system. So they can actually send the information of the patient through the system. Do you understand? So that the doctor can actually have access to it. And if there's any issue or whatsoever, they can actually have a meeting, basically. So in the healthcare system, we don't have like a setting time, just like the nurses knowing that, okay, after this shift, we are going to have handing over, right? But when it comes to the professionals in these facilities, we don't have like a particular time. All you need to do is just to communicate when you obviously see this patient, probably through call or through physical means, basically. So
Sorry, can I add to that? Yeah, hello, Mr. Semeton. So ideally in an hospital care settings, patient is our focus. So in the sense that, let me say, for example, now you have a ward C, and in that ward C, maybe you have like 20 patients. Although in the normal healthcare setting, we have like 4 nurses there. Each nurses can have like 5 patients to them, you understand? So what I mean by patients is our focus in the healthcare system, in the sense that, one patient like let me say this is a patient Ajayi, you understand? This patient Ajayi, you may have a doctor in charge, you may have a nurse in charge, you may have a therapist in charge, a pharmacist in charge. So in a normal healthcare setting, although it may not be something in practice a whole lot in Nigeria right now, we have something we call ward round. So in a ward round, it's going to include the doctor, the nurses, the pharmacist, you understand, the physiotherapist, even physiologist, you understand. So what I'm trying to say in the sense that, they are trying to see Dr. Patient Ajayi. So during that ward round, those people are involved, you understand. They discuss about the condition of Mr. Ajayi. That is a stand-up in a way. You get what I'm trying to say? Although this is like a knowledge, I think we still appreciate it more. Maybe as time goes on, as things are going remotely, maybe there's an app in an healthcare setting that can solve this problem. But it's not something that are really taking so much serious or being a major focus. But it's actually be a better thing if you have people that can come up with an idea in that line. But right now, so that is what we have as a stand-up in an healthcare settings. Thank you.
Nice.
All right, thank you guys. Thank you.
Thank you,
All right,
everyone.
please, I want to ask a question.
Okay, because we are out of time.
Okay.
Let's just give 1 minute for that.
All right. Somebody just said something about what I want to ask about how they do sprint planning in an healthcare system. So he mentioned those that are involved, but from my own perspective, I'm thinking, do they really do the form of sprint planning in the healthcare system? But where I see sprint planning maybe to come in is where you have special cases and you need to maybe perform some procedures, maybe a surgery. So that's where I see people from different teams coming together to discuss about their plan. So, but for other processes, I'm not so sure they do sprint planning, because what we used to experience is that you meet your doctor, then your doctor don't necessarily have to meet with anybody before starting anything on your own treatment. So maybe they have to just get the results from. So they don't really meet to say, let's plan this. But the other one I said before was when you have to, maybe you have to do a CS or you want to do perform a particular operation. So that's when I see that sprint planning come into place.
Yeah. Nice.
Are you seeing anything? Hola.
Hello?
No, I'm not